Hi, I'm Dr. Joe LeMaster, Local Health Officer for Johnson County. As we've said before, the vaccine is there. If you haven't been vaccinated and are considering it, this is the time to do it. Boosting is available. We've got plenty of booster doses. They are available through the county via appointment. You can come in and get that done. As you know, we strongly recommend you to wear a mask inside all public places. This is even more important for those that are immunocompromised. That would include people who have severe chronic illnesses, like those who are on dialysis or those who are taking any kind of immunocompromising medication like steroids or anything that would beat their immune system down. They may need extra protection, so it's very important if you live and work around them or have any contact with them. Please continue to remember to do all the other things, keeping distance from those who are sick, or keeping distance from others when you're in an indoor place. If you're sick or get sick, please stay home. Don't go to a gathering if you're having symptoms. Remembering that with the new Omicron, the symptoms may be a little different than they have been in the past. We're getting a lot of information now that the Omicron symptoms are more like just cold symptoms in the early stage. People may not have a cough. So it's very important, if we don't want to see the number of cases that happen in our area with Omicron go through the roof, then we very much must do everything we can to try and prevent that happening. Remember now, as we look at the hospitals are already very full, not necessarily just due to COVID, but due to all the other things that bring people into the hospital now. We're having very full hospital registries. There aren't a lot of beds available. Even though it may turn out that the Omicron does not have as high of a hospitalization rate as Delta, if the number of cases goes up 4 or 5 times, that's still going to overwhelm the hospital system. So it's very important that we do all that we can at this point in time over these holidays at the end of the year to do what we can to protect one another. If you're coming together, test before you go. Tests are widely available through healthcare providers, through pharmacies. If you're not sure where to get the tests, go to knowbeforeyougo.kansas.com. Over-the-counter tests are also very good as a first line of testing. If you have a positive test, you need to go ahead and get the PCR test through the knowbeforeyougokansas.com. Find a place to help you do that. They are still available around our Kansas City metro area. Continue to wash your hands often, especially if you have a cough or a sneeze. Clean high-touch surfaces and monitor your health. Watch for those symptoms like fever, cough, shortness of breath, body ache, runny nose. Those are all things that if you develop them, you should go and at least do an over-the-counter test to see whether you might be positive. Remember that all of the tests we do, including the PCR, can have a false negative rate, so serial testing is a good thing to do, especially if you're symptomatic. Test one day, and then if you're negative, test the next day if you remain symptomatic. Strongly advise not to get together with other people if you are symptomatic or you're sick. Let's do all we can to take care of one another during this holiday season.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to an e-newsletter with the latest data and precautions being taken in the county and state.